Hello guys, as we are studying lower limb anatomy, our today's topics of discussions are femoral sheath, femoral canal, femoral artery, femoral vein and femoral nerve. We will cover all these five topics in this video. So we should know what is femoral sheath. It is a funnel shaped sleeve of fascia cover upper 3 to 4 centimeter of femoral vessels. So what is fascia? Fascia is a thin covering of connective tissue, means it covers the contents present in it. Or in other words, we can say it is an outer covering. So the femoral sheath is a fascia which cover femoral vessels, means femoral artery, nerves and veins. It is formed by the downward extension of two layers of fascia of abdomen, means the two fascia of abdomen make the femoral sheath by downward extension. Now comes to the boundaries of femoral sheath. Its anterior wall is formed by fascia transversalis. Its posterior wall is formed by fascia iliaca, which covers iliacus muscle. Inferiorly, the femoral sheath merges with connective tissue around the femoral vessels. You can see in the diagram that fascia transversalis, the green color one, on the left and fascia iliaca on the right one. Now come to the compartments. It is divided into three compartments: lateral, intermediate, and medial. So its lateral compartment is formed by femoral artery and femoral branch of genitofemoral nerve. Intermediate compartment contain femoral vein and medial compartment contain femoral canal and contain lymph nodes. The femoral canal we will study after this. You can also see the compartment and its contents in the diagram given below. Now comes to the femoral canal and ring. As we discussed earlier in femoral sheath, that the medial most compartment is our femoral canal. So the definition says it is the medial compartment of femoral sheath, conical in shape, wide at base means its upper part is wide, and narrow below means its lower part is narrow. You can also see in the diagram the labeled one, femoral canal with lymph node. Now what is femoral ring? The base or upper part of the femoral sheath is called femoral ring. See the diagram given above, the labeled femoral ring. Now comes to the boundaries of femoral ring. We are discussing the boundaries of femoral ring. Now look at the diagram given below. Its anterior part is formed by the inguinal ligament, the green one. Its posterior part is formed by the pectineus muscle, the purple one. Its medial part is formed by the lacunar ligament, the red one in the diagram. Its lateral part is formed by a septum separating it from femoral vein, or you can simply say the femoral vein, the blue one in the diagram. Now, what are the contents of femoral canal? What are the things that are present in femoral canal? Are the lymph node of Cloquet or Rosenmuller, lymphatics, and a small amount of areolar tissue. That's all about the femoral canal and ring. Now comes to the femoral artery. It is the main artery of the lower limb and its parent artery from where it arises means it is a branch of external iliac artery, and external iliac artery in turn is a branch of abdominal aorta. So when external iliac artery crosses inguinal ligament, it becomes femoral artery, and then femoral artery enters the femoral triangle. So what is profunda femoris artery? The posterolateral aspect of femoral artery means from its posterior and lateral part an artery arises called profunda femoris artery, means it's a branch of femoral artery. Profunda femoris artery in turn gives off three branches. Number one, perforating branches. It perforate means it supplies adductor magnus muscle. It also supplies the muscles in medial and posterior thigh. Now the second branch is lateral femoral circumflex artery. We can also write it as LFCA in short. It wraps means it is present around the anterior lateral side of femur. Femur is a bone present in our lower limb. So if you asked about the anterior and lateral side which artery is present in femur, you can say it's lateral femoral circumflex artery. It also supplies the medial and posterior thigh muscles. Now the third branch is medial femoral circumflex artery, MFCA you can say in short. It is present around the posterior side of femur bone. It supplies its neck and head. So if you asked about the fracture or injury to the head and neck of femur and say which artery is damaged, you will say medial femoral circumflex artery. So it exits the femoral triangle, continues downward in anterior aspect of thigh, means it's supplying the anterior aspect of thigh, and came downward through a tunnel that we call adductor canal. We will discuss adductor canal later. Now femoral artery enters the posterior compartment of thigh, and now the femoral artery is known as popliteal artery. Given below the diagram, you can see the femoral artery and all its branches. Now comes to the femoral vein. Femoral vein begins as an upward continuation of popliteal vein, means when popliteal vein moves upward, it becomes femoral vein, and it ends by becoming continuous with external iliac vein, means at the end it becomes external iliac vein. Now comes to the tributaries of femoral vein. Tributaries means it receives branches from the following veins. It receives branches from, first is great saphenous vein. You can also see in the diagram the great saphenous vein. Number two, veins accompanying three deep branches of femoral artery in femoral triangle named profunda, deep external pudendal, and muscular veins. It means these three veins that I mentioned accompany with the three deep branches of femoral artery. Number three is lateral and medial circumflex femoral vein. You can see in the diagram all these veins. And number four and the last is descending genicular and muscular vein in adductor canal. In the diagram, you can see all these veins drain into the femoral vein, means they are its tributaries. Now comes to the femoral nerve. Femoral nerve is one of the major nerves of lower limb. Its nerve roots means it arises from the lumbar region of the spinal cord, L2, L3, L4 division. Now comes to the function of the femoral nerve, or you can say which areas femoral nerves will supply. So there are two functions, namely motor functions and sensory functions. Now comes to the motor functions. It innervates, means it supplies the anterior thigh muscle, means the muscles present in our anterior thigh. Its sensory functions, it supplies its anterior cutaneous branch to the anteromedial region of the thigh, means it gives its sensory branch to the anteromedial aspect of thigh. Now comes to the anatomical course, means where it arises, where it goes, and where it ends. So it arises from lumbar plexus of the spinal cord, travels inferiorly to psoas major muscle, passes from inguinal ligament, enters the femoral triangle, approx 4 cm below the inguinal ligament. It divides into anterior and posterior divisions. Means femoral nerve will divide into anterior and posterior divisions below the inguinal ligament. Now comes to the function of anterior and posterior division of the femoral nerve. First is anterior cutaneous branches. Second is the branch to sartorius, means it supplies the sartorius muscle, and branch to pectineus muscle, means anterior division of femoral nerve will supply to sartorius and pectineus muscle. Posterior division, at posterior division it becomes saphenous nerve, and it supplies branches to quadriceps femoris muscle, and it terminates as saphenous nerve. Given below is the diagram. You can see the femoral nerve, then its branches, and then it continues as saphenous nerve below.